Are you trying to understand Medicare? We all know that there are a lot of parts that can make it really confusing. So in this video, we want to talk to you about one of the 4 parts of Medicare, which is Part C, or Medicare Advantage. We're Shannon and Michael. We're the founders of Healthcare Genius, and for the best information on healthcare and retirement, subscribe to our channel and click the bell to be notified when we come out with new videos.
What is Medicare? Medicare is the national health program for people who are over the age of 65. There are a few exceptions if people have certain illnesses or are disabled, but for most people, they're going to sign up for Medicare on their 65th birthday or later. There are 4 parts to Medicare: Part A and B, which make up original Medicare, Part C, which are Medicare Advantage plans, and Part D, prescription plans. Today, we're going to talk about Medicare Advantage plans, Part C. I like to think of these plans as an old commercial I used to see for an oil filter company. And the mechanic in the commercial used to say, you can pay me now or you can pay me later. When we talk about Medicare Advantage plans, we really think of these as pay me later type plans, because you're not having to pay a premium up front for them, for most of them. You're going to pay co-pays and deductibles and things like most of us are used to when it comes to having a regular health insurance plan when you're working, or you have a $25 co-pay, or you have to pay $300 a day when you go into the hospital. Those are really what make up Medicare Advantage plans, and it's why people sign up for these plans, is because they don't necessarily have to pay for anything up front. Now, they're very popular. In the last 10 years, they've grown by 50%, at least enrollments, but they are a little confusing, and so we just want to clarify really what happens with a Medicare Advantage plan. Essentially, the government is paying that insurance companies, and they're most of the major insurance companies that we see, they're paying them a monthly premium to take over their responsibility for your health care. So that's a key point. When you are on a Medicare Advantage plan, and it's paying out a doctor or a hospital, it's actually the insurance company that's paying that out. It's not the federal government.
Right, and it's still overseen by Medicare, so that's why you'll see a lot of these Advantage plans that have at least the original Medicare benefits and then some. But some of these insurance companies, it's really all the big ones that you think of, and you probably see a lot of ads for them on TV, but they're the ones that take over and manage these Medicare Advantage plans.
And interesting, in our market, we're seeing more companies enter the market, and so we're seeing co-pays go down, out-of-pocket costs go down, and we're seeing them add lots of different benefits, which Shannon will talk about. But each plan is going to be different. They have to, as Shannon said, at least have the same benefits that Part A and B have, but they can add additional benefits.
That's right. So if you haven't watched our videos on Parts A and Parts B, original Medicare, there's one for each of them that we've put out, and we recommend that if you don't understand those really well, go watch them now, because what we outline in those videos is that there are a lot of what you might think of as holes in original Medicare. They don't cover prescription drugs. They don't cover things like vision, dental, hearing aids, some things that can be really expensive in retirement. And these Medicare Advantage plans, a lot of them do cover these types of things. So that's really one of the big reasons why people do get these plans, is because there is additional coverage outside of what original Medicare covers.
And it's interesting, Shannon, my mother is looking at hearing aids. We just actually purchased some, but she's also looking at different Advantage plans this year, because some of those cover hearing aids. So in the future, if she needs them, she's thinking maybe they'll cover it. She had to pay for it out of pocket today.
That's right. And another really great thing about Advantage plans that I want to point out, which your mother is a great example, she's past 65 significantly, but she can still sign up for a Medicare Advantage plan and not have any underwriting that she has to go through. And that's a really unique thing about these plans, and what can be really appealing for some people, particularly older in age. So there are a few different types of plans that you'll see when you're looking at Medicare Advantage plans. One of those is HMOs. And so what that means is there's a network of providers that you can choose from when you need to get something done, but you really can't stray outside of that network. There's also what we call PPOs, and those types of plans also have networks, but you can go outside of the networks. It's just a little bit more expensive, but you still do have some coverage. And then we also have the private fee-for-service plans, where there is a network and you can go outside of that network, but then it's up to the provider if they want to accept you or not. And then we have what we call Medicare specialty need plans, and these cover a particular group of people that have a similar situation. So whether it's kidney disease or diabetes, these plans kind of cater to a particular group of people.
And there's one other type of plan, Shannon, that we see that's fairly popular, becoming more popular, at least the insurance companies are offering these types of plans, and they're called dual eligible plans. So those are designed for people who are on Medicaid, could be somebody in a nursing home who's gone through all of their assets and now the government is paying for their nursing home care through Medicaid, but they also qualify for Medicare. So those are plans that are out there that will provide some additional services to those beneficiaries, like the dental vision and the hearing aids, that may be attractive to somebody, or if it's a family member taking care of a parent or grandparent, that can offer some additional benefits that might be worthwhile.
So most people don't realize how many options there really are. Hopefully you're starting to see that in the video, but comment below and let us know what your thoughts are.
Another thing, Shannon, too, just to follow up on those doctors, the one thing that you need to make sure of when you're looking at these plans is that your doctor's in the network. So that will be, I mean, yes, some of them will cover outside, but that doctor may or may not accept it. So when you're doing a research, you need to make sure your doctors accept those plans. That's kind of the first thing. And then the other part on the drug coverage is each one of these plans, most of them have drug coverage, but that may differ. So you're going to want to make sure that the drugs that you're taking match up with the plan that you choose. So there's just a couple of things to think about. So another question that comes up is, what do these plans cost? As I mentioned, the pay me now, pay me later. A lot of times there isn't a cost up front for the plans, but when you go into the office, it might be $30 that you pay to see the doctor, or you might have to pay $300 per day for a copay for hospitalization. Most plans do have maximums. Those can range from $3,000, $4,000, $5,000 out of pocket. So just be aware of that when you're signing up for these, that they, even though the premium may be zero, there may be other out-of-pocket costs that you have. And when you're eligible for Medicare is typically when you're a U.S. citizen and age 65 or older. There are a couple of exceptions to that when you have end-stage renal disease or ALS or Lou Gehrig's disease, or you're disabled on Social Security disability. Those are normally the ways that you're going to qualify for Medicare. You will have to sign up for Medicare Part A and B before you're able to actually sign up for one of these Medicare Advantage plans.
Yep, and so when you think about, okay, maybe I want to consider signing up, the first thing that you do is, like Michael said, sign up for Parts A and B. You can do that through the Social Security Administration directly. But then there's actually a different process that you have to go through to get a Medicare Advantage plan. And what we've done is we've actually created a marketplace where you can go and look at your different options. And if you do want to start planning and get ready for when the time does come, go ahead and visit the link in our description below so you can apply to become our client. Again, we're Shannon and Michael with Healthcare Genius. For the best information on retirement and healthcare, subscribe to our channel, like all our videos, and click the bell to be notified when we come out with new videos.